think that the Alliance is going to enable us to enhance the image of healthcare at home, both from a provider perspective and better promote the quality of care that is delivered in the home setting.
I'm very excited that we have got to this place where we will have a national organization of the two coming together. It's very important that we have a single voice in healthcare delivery that we are most involved in, being primarily the community-based type care, home health, hospice. Putting our resources together in a much more effective way will drive efficiencies, will, I think, better alignment in the types of advocacy work that needs to be done. So bringing people together in a much better way, all working towards focused goals.
As we continue to be faced with reimbursement cuts, regulatory changes, there's more headwinds than tailwinds propelling us, but these two organizations coming together is the exact tailwind that we need to make a flywheel effect and really drive change in the industry.
Having a voice that can speak to both home health and hospice and advocate for both equally, if you will, again, is going to help our entire industry. I think policymakers don't always have the best understanding of either industry, and so, but having a louder voice is, I think, going to help us in the long run.
The one thing that I've learned in Washington more than anything else over the years is divided, you find yourself weakened when you're dealing with Congress and with regulators. So the combination of NAC and NHPCO has gained that kind of unification that will be the embodiment of a strength in the voice in terms of particular priorities and particular outcomes that are being sought.
I think with the new alliance, we can amplify our voices to policymakers because we'll have more resources to do that. We'll be a unified front, and we'll be able to really get our message across because there's strength in numbers.
It's going to make us stronger as a unit in being able to fight against some of the CMS attacks that we have been constantly under for the last few years. It is going to bring agencies together into a team that will be able to fight those forces as well as know that we're on each other's side and that we are stronger than ever together.
You know, I'm really excited for the future. I think there's so much that we can get done when we're joining together with another organization, which we've worked really so closely with. You look over the past 2 years from, the 34 recommendations that we put out for program integrity, our work together on ensuring access to the benefit, we really are aligned on pretty much close to 100% of issues. And so, being able to pool our resources, to be bigger, to be louder, to be more active and more engaged, I think that really spells a positive future for hospice, but also home health as well.
You've got to have a unified voice that's strong and that's clear and that's direct and that's coordinated, and that is a huge potential for what remains in front of us with the Alliance coming to fruition.
I think there's been a lot of work done in the industry over the last few years about the image of healthcare at home, the place that it has in the healthcare continuum, and especially with the workforce shortage, the ability for our industry to attract healthcare workers. We've done a lot of research with that around those issues, and as chairman of the board, it's my intention to set up a special committee of the board focused on image of our industry moving forward to continue this important work.